Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose is to deliver technology that improves healthcare in their communities. Well, today we welcome Kevin McDonald to the CereCore podcast. Kevin is the Chief Information Officer for HCA Healthcare's South Atlantic division. Under his strategic direction, he and his team support large, complex hospitals and emergency, surgery, and urgent care centers throughout South Carolina, Georgia, and Florida, all known for outstanding patient care, innovative technology, and pioneering new medical procedures. Kevin began his career with HCA Healthcare in 2011 with the auditing group, transitioning to a number of senior facility director IT and operations roles before moving into his current CIO role. Prior to joining HCA Healthcare, he spent time with JP Morgan Chase & Company. Kevin earned his MBA with an information technology management concentration from Western Governors University and a Bachelor of Science in Business Administration with an information systems focus from The Ohio State University. Kevin, welcome and thank you very much for joining the CereCore podcast.
Thanks, Phil. Love the emphasis on The Ohio State University. Happy to be here.
Well, watch enough football and you understand how it's supposed to go down. So
that's right.
Well, Kevin, maybe we'll just start with a little bit about your background. We touched on it a little bit, but maybe if you wouldn't mind, just give us a little bit more detail and information about your professional background, and then your role as a CIO in the division that you lead.
Yeah, certainly. It's been a journey. So I decided in around 2008 to leave my career in finance and seek a opportunity with a industry that I felt would make a bigger difference. I could really find that ethical and moral compass that led me to satisfaction when I came home every day. And that's when I found HCA Healthcare. So I started within their internal audit team. So I was doing IT audits, security and compliance type of audits. After a couple years in the audit department, I decided that I wanted to move into a role where I wasn't telling our hospitals how they should be performing certain functions. I was actually doing that. So I found a CIO in Houston that was willing to take a chance on me. So I moved into a hospital director role in Kingwood, Texas. Spent a couple years there, and we were starting the separation of our North Florida division and creating a distinct South Atlantic division. I thought, wow, it'd be neat to be part of a new creation of an IT division. That's when I reached out to the current CIO at the time and found myself in a role over 2 hospitals here in Charleston, South Carolina. So I was over Trident Medical Center and Somerville Medical Center, both outstanding care facilities here in the Low Country. Not too long after that, we had acquired a major hospital in the Savannah area. And that was my first introduction to Epic and my first introduction into a major acquisition and integrating a health system into HCA. So I spent almost a year in Savannah, returned to Charleston after we got that acquisition on track, and lo and behold, our VP at the time called and said, hey, we're doing another acquisition in Asheville, North Carolina. Would you like to lead that? So I was given the opportunity to move to Asheville, North Carolina, and lead the acquisition of Mission Health as the IT on the ground lead there. I was there for 3 years. My boss back here in Charleston decided to take a role in one of our Texas divisions, and he said, do you want to come back and serve as a CIO here? So that's how I ended up back here in Charleston for the second time, and have been in the CIO role for about 2 years. And it's been an amazing experience, amazing journey within HCA.
No, that's excellent, and I appreciate you touching on just kind of the whole concept of that mission-driven value when you're thinking about career, because that is certainly something that all of us that serve the healthcare community feel on a daily basis. And I think that's why we remain and do the work that we do. So, I certainly appreciate you saying that. And what an incredible journey, and quite frankly, some experiences that not a lot of folks get to have. In and around leading the acquisition, sorts of the work that needs to take place in order to bring an organization that's been operating for years and years and years, into a new operating environment. So that's very neat. So, maybe tell me a little bit about your leadership philosophy, particularly when it comes to building high performance teams, and certainly you've had to do that in a lot of different roles and responsibilities over your career, but certainly those are areas that are critical to the healthcare IT industry.
For me, it's really all about making that investment in our employees. I know that if I invest in the development of our employees and I invest in the growth of our employees, that's going to pay dividends. And I'm going to have a motivated workforce that wants to come to work every day and wants to continue to grow in their own personal journey and career. So that's really been a cornerstone of how we've elevated the South Atlantic division. I started here with a fantastic foundation, but we've really been able to continue investing in our employees. We've stood up several training programs for them, technical programs, clinical programs, and then we advocate for them. We advocate for their career growth. And if that career growth is outside of my division, I accept that and I pick up the phone and I call the hiring manager for them, because at the end of the day, I'm going to cross paths with that employee again. If they take a job with our corporate office in Nashville, they're still going to be supporting me. So that's really been, I would say, the secret sauce of this division. Develop, grow, create a highly engaged workforce that we can objectively measure through our engagement surveys, and continue to focus on raising that bar every day.
Yeah, no, that's great. I think certainly, when we talk about mission, it does start with the people that are around us, right? You take care of those people, and they're going to take care of the work, which then takes care of our communities. So, I think you're spot on with that approach. So, as you're building those teams, there's a lot going on, right? A lot of demands. How do you keep your teams, nimble? And able, it's easy to fall into that kind of operational mindset, right? But how do you keep those teams nimble so that they can respond to the types of demands that pop up, on a day-to-day basis, and heaven forbid, the cursed thing in IT, right? An outage.
Yeah. So I think, we can do everything possible to prevent an outage or prevent an unexpected demand, but we know the inevitable is going to happen. So for our teams, if we look at an example of a downtime, the biggest thing that we've done is create a repeatable framework that we can quickly put into place in the event we have an outage. So we work heavily with our corporate counterparts on the IT operations center, but we've developed our own critical event framework. And that starts with having an accountable leader 24/7 who manages that incident from the get-go. We leverage our tools very heavily. So WebEx Teams, our instant messaging tool, has really been a game changer for how quickly we can get our arm around an incident and pull in the right resources to resolve that quickly. And that's ensuring that everybody knows their role when you hit that red button, when that alarm goes off. So do we have the ability to quickly engage a network engineer, system administrator, a clinical resource to identify the issue, triage the issue, and then restore? So that framework and playbook, if you will, has allowed us to be ready at any moment's notice to go into that reactive recovery mode. And then after we have that incident, we take a step back every time and we say, what could we have done to prevent that? What do we need to adjust going forward to prevent it? And if we don't think we can completely prevent it, how do we respond even quicker, more efficiently, and more effectively next time this type of incident occurs? And we have grown so much in this space from a maturity perspective. I can't believe how quickly our teams engage and reach a resolution compared to where we were 5 years ago. It's really incredible to see, but your goal is always to reduce those incidents and be as proactive as possible.
Oh, absolutely. No, you hit the nail on the head. So many organizations don't take the time to install that, that documented process. But then at the same point, it's one thing to have the process. It's another thing to train people on it and to
Yeah.
make them aware of it and to, keep revisiting it, just as you said, to make sure that, okay, are there things that we can do better? Throughout that to really close those time loops and identify those other areas. I mean, technology is technology. Sometimes stuff just breaks.
Yep.
And it's how we respond. So, can you think of a time or an experience that you all had where, maybe a particular technology really helped the hospital get through, one of these sorts of events?
Yeah, I think, one that really comes to mind is when we had a outage of our thin clients at our hospital in Savannah, a very large hospital that is heavily dependent on in-room and at nurses station workstations. And what had occurred, it's a little bit interesting. What had occurred is those devices had a certificate that expired that connected them to the wireless network. So they all lost connectivity simultaneously. So our clinicians didn't have that natural access to the patient chart that they were used to. One of the things that was so incredible is I was talking to our senior IT director there and really gauging how impactful this was. Obviously, in my mind, it was going to be tremendously impactful and what we could do to help mitigate this. He said they're naturally picking up their iPhones and just using Rover, the Epic Rover technology, to look at the patient's chart, to look at the medications, continue to do safe medication scanning and lab scanning. So it was really impressive to see that natural adoption of a mobile technology in the event of a thin client downtime without IT even saying, hey, everybody grab your iPhones and start using Rover. So that one really stands out to me as a pretty remarkable and natural way for people to adopt that technology in the event of a downtime.
Absolutely. No, that's fantastic. And, first and foremost, having it in place and available. And then two, you're right. I think at the end of the day, our clinicians, the, clients, et cetera, they know what's at their fingertips. Especially if we're, on top of things and training them and, they're going to figure out ways and creative ways and, it's fun to listen to them. It's part of the rounding that I'm sure you do all the time and your team does all the time with the clinicians to see, hey, what are you using? How can things get better? And where are those gaps? And it's part of that never ending learning process for those of us in IT to help make things better. So that's great.
Absolutely.
So you've now had a good bit of experience on the Epic side of things, on the system side of things. Maybe what are some of the accomplishments that you're most proud of?
Yeah, I think, Rover adoption is really something that we're proud of in the Savannah facility for our nurses. But one of the other mobile technologies that I'm always astounded by is how much our physician base has adopted the Haiku and Canto mobile solutions for Epic, the physician-facing mobile solutions. We have some of the highest mobile adoption of any hospital within HCA. Our mobile adoption in Savannah is higher than some of our divisions. So it's really remarkable to see. And our CereCore partners actually just enhance that solution even further within the last couple of weeks by having a PACS image viewer directly available on that mobile device. So we have truly given those physicians an all-encompassing mobile platform for their usage when they're on the go in the hospital at home on call. It's really an adaptable solution. So I'm incredibly proud of where we've come with physician mobile adoption along with nursing mobile adoption. And I think that we have so many opportunities within Epic. It's really remarkable what we can do from a scheduling perspective. We're starting to look at the ticket scheduling options, the ability, I call it the Resi solution, where you can say, I'd like a sooner appointment if one becomes available, and it notifies the patients when that appointment slot opens up. I think that we're scratching the surface with some of these next generation Epic technologies, but I'm really excited about it. We're looking at Hey Epic and really looking forward to the future of what we can do with an Epic and what we've already done.
Yeah, no, it truly is amazing when you get these technologies in the hands of the physicians and the clinicians, and just to see them go, oh, this is a game changer. You just saved me this amount of time, or you just enabled me to have this information when I needed it in a critical situation to really provide, care that otherwise wouldn't have been delivered. So it's, again, back to that mission. So that's fantastic. But one of the things, and thank you for bringing it up is the partnerships, and so, certainly is in your role and every CIO's role, there are those partnerships that you rely on. And so, maybe would you have any words of wisdom just to share about partnerships and relationships between CIOs and their partners?
Yeah. For me, there's so many partnership opportunities with the structure of our company. So I look at our partnership with our corporate resources and as an extension of my team, and I treat them with the same respect that I would a member of my team. I look at our CereCore partnership. CereCore, for the folks listening in, they support our Epic system for us. And I have to view them as a natural extension of my team, include them in things that I would include my same direct team members in, and really build that personal relationship with those individuals. So that's really been the secret sauce. Don't look at them as a vendor or a vendor partner. Look at them as a natural extension of your team. And for somebody like me who's grown up in a matrixed organization, that comes a little naturally. But I think that tendency to not view them as that natural extension of your direct team can really cause that relationship to build a little slower than it would otherwise. So that's my best advice. Fold them into your inner circle, make them part of the team, set the expectations, hold them accountable, but also create a good personal relationship with them. And I promise you that they'll be there for you in your time of need, and they will perform how you want them to perform if you treat them respectfully as a member of your team.
That's fantastic advice, Kevin. Certainly, when you do that, that line of communication is always open, and there's no guesswork that's going on between the partner and the hospital or health system. So that great words of wisdom there. So, as we wrap up today, I always like to just kind of, I don't know, throw the door open a little bit for, any sort of last CIO perspectives, words of wisdom, things that, you've learned over your tenure, both at HCA and really just in your career in general, that you feel like other CIOs, should at least be aware of or paying attention to.
I think the biggest thing for me is I grew up in a world of operations, and having clean running operations to me is the foundation to allow you to execute on your strategic vision. So that's always been a major platform of mine. If I have built the foundation of operational excellence, then I get to do the strategic and innovative activities. So for the CIOs out there, don't take your eye off the ball of operations. At the end of the day, the nurses in these hospitals, they want to do their jobs. They want to take care of the patients, and we want to help them take care of their patients. And functioning, high available systems are the cornerstone of that. And then we can start to build those additional capabilities out. So that's always been a big driver for the way
Right.
that I run my IT programs.
I think you're spot on. I think I've heard another CIO mention operations needs to be quiet. When
Yes.
operations is quiet, then you can get to the proactive projects that the entire organization is clamoring for. So, oh, that's spot
Absolutely.
on. Well, excellent. Well, Kevin, thank you so much for your time today. Really appreciate your partnership, but also your time and words of wisdom and insight for our viewing audience. So, greatly
Yeah.
appreciate it. Thank you.
Thank you, Phil. It's been fun.
All right. Thanks for listening to the CereCore podcast. If you like this conversation, check out our other episodes. Visit us at CereCore.net to learn more about our IT services and connect with us on LinkedIn. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.